Good afternoon. I'm sorry I'm a little late today. It's nice to see the sun out, and it truly feels like spring. Again today, we have no new cases of COVID-19 to report in Prince Edward Island. We have 111 new negative tests from yesterday. I'd like to just sort of point out that we've had one case in the last 2 weeks, and a total of 6 cases for the month of April of COVID-19, and all of our cases have been related to travel. As we move ahead and begin to ease back on some of our restrictions, it is important that we continue to increase our testing and continue to look at it. And of course, our approach to testing will continue to evolve as the situation evolves. And I probably need to clarify this from yesterday, but the testing at the bridge began earlier this week on Tuesday, and it has been added as part of our testing for long-haul truckers who reside in Prince Edward Island. And this was coordinated in consultation with the industry, and it was particularly due to travel schedules. It would be challenging for these many of these long-haul truckers to get to swabbing clinics in Charlottetown or Summerside, and they're sometimes not in Prince Edward Island for too long. The clinics in Summerside and Charlottetown are available for others requiring testing. And I was also asked again, and I know we've said it different times, we encourage anyone with symptoms of cough, fever, headache, chills, and new onset of weakness, new onset of fatigue, sore throat, and runny nose. If they're having symptoms, please call 811 or have your family doctor or nurse practitioner refer you to a clinic for testing. And I do need to mention that this is not the time for non-essential travel into the province. And with the help of EMO, the Emergency Measures Organization, there is more enforcement and a pre-travel approval process in place. I would like to just mention different groups of essential workers, because we often talk about essential workers, and I'd like to reference a few examples. And they would be our vehicle drivers and our truckers who are delivering goods and supplies in and out of Prince Edward Island. Those who may work in policing or military, our temporary foreign workers, healthcare workers such as locums who may be working in our emergency departments, people who work in certain construction projects who are specialists who may not be available here in Prince Edward Island. Also note that islanders with appointments in other provinces, of course, are able to travel back and forth. Again, I need to mention one more time, or probably not one more time, we'll continue to talk about self-isolation, and that self-isolation does mean staying on your property for 2 weeks when you return to Prince Edward Island. That does not mean going to the grocery store. It means not going to the bank. It means not visiting, for instance, at a long-term care facility. Essential workers, if they've returned to Prince Edward Island, are to self-isolate when they are not at work. And to note, and we do update these numbers regularly, we have 2,130 people who are on self-isolation in Prince Edward Island at this time, and that includes 600 essential workers. And these are the people who are getting daily calls to help support them during their period of self-isolation and make sure they understand self-isolation. We've had a number of questions regarding temporary foreign workers and how they are arriving in Prince Edward Island, given that New Brunswick is not allowing any temporary foreign workers to enter at this time. To my knowledge, all other provinces are having temporary foreign workers. Temporary foreign workers are considered essential workers to ensure our food supply chain is not interrupted, and this is important for Prince Edward Island. Temporary foreign workers in P.E.I, we have really developed a proactive approach to make sure that temporary foreign workers are able to self-isolate, so are taken directly to a facility in Prince Edward Island. And like everyone in P.E.I, when they return, temporary foreign workers must self-isolate for 14 days following their arrival to Prince Edward Island. They are housed in individual rooms and are provided with information on all requirements. There's also close monitoring by a nurse for temporary foreign workers during their stay in self-isolation. Temporary foreign workers are tested for symptoms if they have symptoms of COVID-19. And all temporary foreign workers are tested prior to them going to their employers. So they would all have a negative test prior to going to their employers. And so I hope that helps clarify some of the process around the temporary foreign workers. And although through the Renew P.E.I Together plan, we're speaking about easing back some restrictions, and I know some of that, we're thinking a lot about it as May 1st is upon us tomorrow. It is important to note that some things will stay in place, and of course, we've talked about those really important public health measures of physical distancing, staying at home when you're sick, the good hand hygiene, enhanced cleaning measures, and they will be in place during the phases that we've laid out. And border screening will continue at points of entry, and all persons entering the province will continue to be required to self-isolate for 14 days. I would like to remind the public, as lobster and aquaculture industries are getting ready for the season, I would like to ask islanders to respect the work that is taking place as they get ready, and we all need to help with physical distancing. And I know there are many specific businesses and organizations that are trying to find out how they fit into the phased approach. And I know our office is working on making sure we get some general guidance available for the website with a template for businesses and organizations. And it would be laying out some of the measures we've talked about, but identifying that an operational plan is needed, that they would have measures in place for enhanced cleaning and measures to try to maintain the physical distancing, and also to make sure that people who are sick are not going to work, for instance. So those, there'll be more information and that people can look at on the website as well. We know that we all want to see loved ones who are outside our household as we start easing into tomorrow. And just a reminder, we need to do this in small steps, and we're starting with some of these measures outdoors. As one of my team said this morning, and I quote, "It won't be good if we have to reverse." So as we are all feeling eager to get started on this ease back, phased approach, I do ask for that we proceed cautiously and carefully so we do this right. And I also ask for individuals, businesses, organizations to be patient with each other, with our office as we go through this. Please continue to be kind to each other. And I think if we can be patient and kind, we will look after each other and we'll get through this together. Et en français, quelques mots. Bonjour. Encore aujourd'hui, on n'a pas de cas de COVID-19 ici à l'île du Prince-Édouard. On a 111 tests négatifs qui sont nouveaux depuis hier. Augmenter notre capacité pour faire les tests est un élément clé pour renouveler l'île du Prince-Édouard ensemble. Et notre approche changera en conséquence de la situation actuelle. L'augmentation de notre capacité de tests va nous permettre d'isoler des cas éventuels, faire les suivis rapides pour prévenir la possibilité de la transmission de ce virus. Et ce mardi passé, on a commencé à faire les tests à tous les travailleurs qui conduisent les camions, particulièrement aux États-Unis, Ontario. Et ce sont partie d'un groupe de travailleurs essentiels. les camionneurs. Et nous avons choisi de le faire au pont parce que ça facilite leur déplacement. Les cliniques à Charlottetown et Summerside sont disponibles pour ceux et celles qui ont besoin de tests aussi. Nous avons bien hâte pour le plan de renouveler l'île du Prince-Édouard ensemble, mais il faut retenir qu'il y a certaines consignes qui feront partie de notre vie pour un bon bout de temps. Et ce sont les mesures qu'on parle chaque jour, la distance physique, rester à la maison quand on est malade, la bonne hygiène comme se laver les mains, plus de nettoyage sur des surfaces partagées. Mais les contrôles aux frontières resteront en place et l'isolement de 14 jours est toujours nécessaire. Et je sais que nous avons tous hâte de voir nos proches, mais on va commencer de même, mais on doit le faire petit à petit. On a des questions toujours à propos des déplacements nécessaires et qui sont les travailleurs essentiels. Et puis, il y a toutes sortes de groupes. Les camionneurs sont un groupe, mais il y a aussi les personnes qui travaillent à l'urgence à l'île du Prince-Édouard, mais qui habitent ailleurs. Les policiers, les gens qui travaillent aussi dans l'industrie de construction, qui peut-être et les spécialistes qu'on n'a pas ici à l'île du Prince-Édouard. Il faut mentionner aussi que les gens qui doivent voyager pour voir un médecin ou à Nouveau-Brunswick, à Nouvelle-Écosse, c'est du déplacement nécessaire. Et vous pouvez voyager facilement. Il y a plusieurs questions sur les travailleurs temporaires de l'étranger et comment ils arrivent à l'île étant donné les mesures que le Nouveau-Brunswick a annoncées. Et je pense que Nouveau-Brunswick est peut-être la seule qui n'ont pas les travailleurs temporaires de l'étranger. Et nous travaillons avec les compagnies directement pour assurer les mesures adéquates pour la distance physique lorsqu'ils arrivent jusqu'à leur destination finale à l'île. Et ces travailleurs habitent des chambres individuelles et nous leur donnons les informations nécessaires dans leur langue maternelle pour s'assurer qu'ils comprennent bien les consignes sanitaires. Et ils doivent s'isoler comme tous les insulaires pendant 14 jours dès leur arrivée et seront testés s'ils présentent des symptômes et avant qu'ils partent de leur période d'auto-isolement. Je vais juste mentionner à la fin que je sais que tout le monde a bien hâte pour le plan qui commence demain, mais je vous demande tout de bien de suivre les phases, de respecter les consignes. Et on a besoin de l'effort collectif des insulaires pour renouveler notre province. Alors, comme j'ai dit en anglais, il faut qu'on ait la patience, on continue d'être gentils les uns les autres et en faisant ça, je pense qu'on peut ensemble renouveler notre province d'une façon qu'on prend soin les uns les autres. Merci.
Hi, good afternoon, everyone. Health P.E.I.'s response to COVID-19 is now moving toward a return in some services that have been delayed while maintaining our capacity. The Renew P.E.I. plan now means we're now permitted to start a reintroduction of certain services. This will not happen immediately, but in the coming days through a multi-phase and a prioritized plan for these services. They need to be reinstated in a careful and coordinated way, considering how each service that returns will impact the system's readiness should additional COVID-19 cases require care. We continue to face global supply chain issues, and while we've been able to secure the necessary equipment and supplies, including personal protective equipment and medications, there are significant worldwide challenges in our supply chain. The extent to which we can reintroduce services will be shaped by the availability of medications and supplies, as well as our redeployed health human resources that will continue to support the COVID-19 response efforts. Our executive leadership team at Health P.E.I, as well as clinical leaders, will lead the reinstatement of services. The Joint Response Team will now shift its primary focus to monitoring the P.E.I. COVID situation, including monitoring our capacity, which we've created, and our readiness to respond should we have to activate some surge capacity plans. And I want to just say thank you to all of the leaders, physicians, and staff, managers and administrators who've contributed to our response so far in our preparations and planning and implementing our surge capacity plans to this point. They've done a huge amount of work and have really collaborated with each other and with all sectors of our system, and it's very much appreciated how coordinated our response has been and to be able to respond so quickly. We will continue to offer the cough and fever clinics as well as the drive-through screening clinics in both Charlottetown and Summerside. And I know Dr. Morrison mentioned this, but they are available for anyone who has any symptoms of COVID-19. And you can access those clinics through 811 or through your family physician or nurse practitioner. Yesterday, there were 72 patients seen at the Charlottetown clinics and 28 in Summerside. Just a reminder that we do still have essential services, and that means many services and programs are available. If you have an appointment, please attend and receive care, as the services we are and will be starting to provide again are very important to maintain the health of Islanders. If you have an emergency or urgent health issue, call 911 or visit an emergency department. If your health issue is not an emergency, please call 811 or connect with your family physician or nurse practitioner or visit a walk-in clinic, as now we've implemented many other options for people who have non-urgent health care issues to be seen over the telephone or through virtual care options. Thank you.
Thank you, Marion, and we'll open for questions.
Nicole Williams, CBC.
Hi, Nicole.
Hello to you both. My first question, actually probably both of my questions will be for you, Dr. Morrison. We know that you spoke with a few folks in the wedding industry earlier today, and you talked about really that there will probably be no mass gatherings, at least for the rest of the summer and potentially for the rest of the year. I'm wondering if you could just elaborate on that a little bit.
Well, hi, Nicole. So I spoke to them as part of a discussion with the Greater Charlottetown Area Chamber of Commerce, and I think what I said on the phone with them was the same as what we've been saying here, that we don't anticipate any large mass gatherings to take place. We have not gone as far as some other places and say that absolutely won't happen in this year, and because I think it's too far to predict 6 months down the road. But certainly for the next we've laid this out, the first couple of phases. We're trying to take this slowly and make sure that we don't see a large change in the COVID cases here. So I think what I said this morning on the phone has been really consistent with what we've been saying, that we don't anticipate any large mass gatherings to be taking place, but I think it's too early to give a date of when that may happen again, and will depend on whether we see a second wave of COVID-19 in the months ahead, when the vaccine becomes available. So there are other factors to consider as well.
Just to clarify, though, is it fair to say that we wouldn't see any mass gatherings before the end of the summer?
I think that's fair to say, yes. Now, and what we've said, and you see in our phases, is that the definition of mass gathering changes, but I certainly do not see it being changing so much that it would allow for a large, huge concert or wedding.
Understood. Okay, thank you so much. And my second question is, I'm wondering if you can just describe what tomorrow will look like in terms of enforcement. Will we see, patrols on streets checking in to make sure that people are following physical distancing guidelines? Are they going to pop into businesses or services? I'm just wondering if you can describe what that will look like starting tomorrow.
So I think one of the parts of tomorrow, the first thing to mention is that there'll be an updated public health order available by tomorrow. So, and that I know will be made go up on the website so that that's clear, and it'll be important for enforcement as well. And a lot of what was in the first phase is some of the recreational activities that are outdoors that really I don't anticipate enforcement would be a significant part of that. As you know, we've been responding already, as even the public health order as it stands now, to complaints. That complaint process will certainly continue, and we've been working with conservation officers and police to follow up those concerns, and so that will continue. In terms of and I think that's why in the second phase, where there are a lot more businesses and retail places to look at, there'll be monitoring and enforcement on a complaint basis, but also so many places being dropped into to make sure they have an operational plan, and our environmental health officers will be doing a lot of that work in the weeks ahead. So I think this is a process, and I know Islanders have been so outstanding at really wanting to follow direction because they want to protect themselves and their community, and I think that will continue as we go forward.
Thank you so much.
You're welcome. Thanks, Nicole.
Louise Martin, CBC.
Good afternoon. My first question is for Dr. Morrison, please. P.E.I. is expanding testing, as you've indicated, and you've talked about the importance of testing, more surveillance, as being a big part of lifting restrictions. You've also said in the past that testing people with no symptoms can produce a false negative. So I'm just curious in how you balance that. Will it make a difference? How effective is considering sort of broadening out how many people you're testing?
Absolutely. That's a great question, Louise. So, and that's also why we're giving some consideration about when you might test someone without symptoms, because it may increase your sensitivity a little bit if you test them so many days after they return to Prince Edward Island. For instance, returning international travelers to P.E.I., if they arrive here, we actually wouldn't want to test them that right there. We would want to test them at least a week later, because that's when you're more likely to have symptoms and even be asymptomatic or pre-symptomatic at that time to increase the sensitivity. There's certain cases where we might actually want to test some asymptomatic people twice. So for instance, at long-term care facilities, new admissions are being tested when on arrival, and then they're actually being tested 7 days later, even if their first test is negative, because if you put those two negative tests together, it will increase the sensitivity. So there is lots of discussion around that, and so those things also weigh into our discussions and our approach to expanded testing, knowing that the majority of islanders and Canadians, and when we have over 50,000 cases in the country, we have some good Canadian data to rely on. Most people do have present with symptoms, but we are concerned about that smaller percentage who may not have symptoms or are pre-symptomatic. So a very good question. So we are conscious of that, and some of our long-haul truckers may have, for instance, when they arrive, they've often been away for a number of days, for instance, in the United States, and they may only be here for 48 hours. So it is, we felt it was still important to test them as they get back to Prince Edward Island. But so it will vary a little bit.
Okay, great. Thank you so much for explaining that. I'm going to give the camera a chance to pivot over to Marion Dowling, because my next question is for Ms. Dowling. You mentioned the global supply chain issues. Can you tell us perhaps which services could be at risk of potentially not opening tomorrow or in the weeks ahead because of supply chain concerns, and what specific items are we talking about when it comes to that supply chain?
So elective surgeries are one good example where we're really monitoring things like the medications, which I know I mentioned a couple times today, because of the needs and demands on some of the sedating medications in particular that would be used for patients who require ventilation or intensive care therapies would be the same medications that we would use for surgery, or endoscopies or scopes when you're sedating a patient in order to perform a procedure. So those are some of the big ones that we do have a concern about the supply chain, given the allocation we've been placed under from our medication suppliers, and just really monitoring that. And it's a balance of having our clinical leaderships, the physicians and surgeons responsible for their patient lists, who are monitoring and looking and pulling in patients who cannot wait for some of these procedures. So many of those things have carried on, but adding to that, elective cases will use some of that supply, which in certain situations we don't have a guaranteed delivery date of additional supply. So that's something we have to balance if we were needing those medications for a surge or an increase in COVID patients. So that's one example. The personal protective equipment is another that we are looking at as well for some of those procedures, which maybe fall in that category of aerosol generating procedures, of the types of testing we might do for cardiorespiratory patients, for example, and some of those things. So it's really any of our services will undergo that risk assessment of the benefit for the patient and what needs to be done, which has continued on as essential for patient care. But there are some other things that we need to start doing that won't be impacted necessarily by those supplies.
Okay, thank you so much.
You're welcome.
Charlotte McCauley, the Eastern Graphic.
Good afternoon. My question is for Dr. Morrison. Excuse me. There are people in the community who consider themselves vulnerable, but they're out in the community and they're like immunocompromised, and they're concerned and even apprehensive with the ease back on restrictions without surveillance testing. So I understand going forward broader testing is part of the plan, but can you explain to these people why broader community testing didn't happen before the decision to open and why it isn't happening now?
I mean, I think we actually have one of the broadest testing criteria in the country, and I think we've talked about that here before. And we've talked, picking up a little bit on Louise's last question, that if you test people who do not have symptoms, the sensitivity of the test is not nearly as high as if you have symptoms. And so that means that people might be tested and they think they don't have COVID, but the sensitivity of the test is not very good, so they could almost have false reassurance. And that's And our testing approach, as I mentioned, will evolve as the situation evolves. But we have, over 3,000 tests of islanders across the province, and we have no evidence of community transmission, and so our testing approach may change at that point in time, but we have been certainly testing people who are sick with symptoms when they come into hospital. We're testing people with symptoms, over 3,000 with symptoms, and they have been negative. And of course, we're really moving into different categories of asymptomatic testing, recognizing that the testing positivity rate is not as high if you do not have symptoms. So in terms of those who are vulnerable in the community, I think they absolutely continue to be concerned and continue to be rightly concerned. And one of the public health measures that we talk about is through all the phases is trying to minimize exposure to those who might be vulnerable, and that includes immunocompromised and those who are elderly. And so I think that's important, and all the measures that we put in place that we talk about are really particularly important to those who may be immunocompromised. So I hope that helps answer a little bit the question.
Sure. Thank you.
Allison Jenkins, The Guardian.
Yes, hello. My question is about the health line as well, and the complaints procedure, just to kind of follow up on some of what you discussed with Nicole. Can you give the update as for the numbers of complaints that have come into the provincial health line?
I actually carried it here with me the last 2 days, and I didn't bring it today. So I could email you. We could definitely email you the number of complaints. I would think it's well over 200 complaints that have been followed up from my memory, and they have followed up with a number of warnings, a large number of warnings, but also there have been charges laid in a number of cases. And I remember, probably a dozen charges have been laid, but I can get those numbers and have those updated for you.
Okay, great. And so for my next question on the same topic, can you explain the process from when a complaint comes in to when action is taken? I'm still thinking back to, as the ease-back measures come into play, perhaps there will be a rise in complaints of things. And I'm thinking back to the Front Step photographers and the Lookout Inn that were shut down and there seemed to be some mixed messages there. So they had heard that things were fine, then they heard things weren't because complainers, some people had called to complain. So is there a smoothed out process there that would give a consistent message to people going forward? And in that, I expect, is the process. So if you could explain the process from the time a complaint comes in to how the decision gets made to take action, like shut down or fine or whatnot.
Okay, so the calls come in different ways. So a lot of the complaints, the majority, I would say, have come in through the 1-800 health information line. And some also come in through Crime Stoppers and the police directly. They are all, for instance, the complaints go through a process in our office. And you're right, this is over the last number of weeks, absolutely, we have had to make sure we get the process right in our office. These complaints then get sent to a particular person in enforcement, and then they distribute them from there. So I think that process now over the last, certainly last 2 or 3 weeks, has been working well, and we do expect an increase in some of those complaints to come in, and we'll adjust. I think with a couple of examples you mentioned, I think there's always sometimes more to it than you may suggest, and so I think that there may be more than just one process that was involved in those cases. But I think we've all learned through this, and it's trying to make sure we respond appropriately to the complaints. And it's also a balanced use of authority. We've talked about that here before as well. It's about education. People want to do the right thing and not put themselves at risk. They definitely don't want to harm their families and their loved ones. And so for the vast majority of the cases, that is what's happening. And the complaints and where the charges were laid, that is all the enforcement side. And they have been a partner in this, and we've been in regular communication, and will continue to be in the weeks ahead.
So just to wrap up, there is an updated process in place.
I think the process that has been in place the last number of weeks will continue. I think, of course, when we first started, everyone was learning this, and so it's not a new process, but I'm sure with multiple complaints coming in, we've probably gotten better at making sure they get funneled into the appropriate enforcement.
Okay, thank you very much. I really appreciate that.
You're welcome.
Carrie Lynn McLeod, Ocean 100.
Good afternoon, ladies. My first question is probably for both of you. There's been a bit of concern, of course, from small business to access, some gloves and masks and hand sanitizers, and particularly among the hairdressers. They are concerned, of course, because it's a very hands-on industry, and how they are to perform that and still maintaining a 6-foot social distancing. So I guess maybe part of it would be for Dr. Morrison, the recommendations for, and then for how do small businesses access the gloves and masks and hand sanitizer, particularly when everybody's scrambling to.
Carrie, when you're breaking up quite a bit, but I think we got the gist of your question. And so I think absolutely lots of businesses will be looking at what makes sense for their particular situation of what their needs may be. And we so a couple of things come to mind. There's the use of the non-medical masks and what role they may play in certain situations for periods of time where physical distancing is not able to be maintained. But we do know that physical distancing is much more important than non-medical masks. So non-medical masks do not replace or shouldn't replace the physical distancing. But having said that, that is one more tool that may be used in certain circumstances. There is a provincial, and I know Marion may speak to this as well, provincial repository of where people are making requests for PPE, but that is usually in terms of the medical personal protective equipment, and that is being distributed, but they are receiving requests, for instance, from first responders as well as health P.E.I. And so I think that process will continue. Those are the kinds of discussions that, along with our infection prevention control staff that works in the community, and with certain businesses and industry, having conversations about what their needs may be will continue to be really important over the next number of weeks. I think I spoke about dentistry yesterday, maybe the needs for some of the personal protective equipment in dentistry would be different perhaps than for the hair salons. So it's looking at that and what is the most appropriate equipment that's needed in both places and in the different settings. I don't know if you want to add to that, Marion?
Yeah, I guess I just would say that it will depend, and I think that's probably one of the reasons why we're looking at a phased-in approach of opening things as well, of what is happening in the community, and just a reminder for any of those businesses or providers, and really for the public, to continue to follow the other good practices of hand washing. Do not go out to these appointments if you're not well and you're sick, because that will protect those workers as well. And so if we all want to get our hair cut on the 22nd, then we really need to help follow this to maintain the safety of everyone who's out in the public. And there is that provincial repository that the provincial government has been collecting and gathering some supplies. So there may be something there that could be accessible to these small business owners. I think the other part, in particular for a hair salon, they would use some of those supplies like gloves maybe as part of their regular day and work, so they should continue to try and source those through their regular vendors as well, because there may be some available that meet their needs and their requirements that are different from some of the medical supplies that we are looking at in that other warehouse or stock.
Great, thanks for explaining all that. And Dr. Morrison, my second question is about campgrounds. Of course, everybody's excited to get to their campgrounds, which for many is a summer home. I believe that's coming in phase 3, yet the gatherings at that time are only allotted to about 20 people at that time. Can you explain how that's going to work?
Yes, so they'll be further. We actually think they'll be ready sooner than later. General guidance on campgrounds. We actually have done some work already on the guidance around campgrounds, and the campgrounds, as you mentioned, anticipated for phase 3, and I think tourism, of course, will be very involved in some of that ongoing discussion as well around campgrounds. It's really the 20 people will be. And that's for outside while maintaining physical distance. So it's not 20 people come all around a campground when you're out, or a fire if you're all cuddled up around the fire. That's not the intention. So there'll be certainly more guidance in place. Some are using, of course, campgrounds almost as a seasonal residence for themselves here in Prince Edward Island, but how they're spaced out, there will not be the same communal kind of facilities open, I anticipate, in the campgrounds. And there's certainly been some guidance as well in different parts of the country, and we'll be looking at that as well before that gets out. So there'll be more details on that, Carrie Wynn, and in the weeks ahead. But we have a few other ones we would like to focus on while still getting the campground guidance ready.
Excellent. Thanks for that explanation.
Okay.
Laurent, la voix acadienne.
Bonjour, Dr Morrison. J'ai une question sur les tests qui sont effectués au pont. Je pense que vous avez répondu à cette question en anglais. J'aurais voulu savoir, les chauffeurs routiers qui arrivent, les truckers, ils ne restent souvent que peut-être 2 jours à l'île. Comment est-ce qu'ils vont avoir le résultat de leurs tests et comment ils vont s'isoler s'ils sont positifs? En fait, est-ce que vous arrivez à communiquer avec eux quand ils repartent?
Alors, Normalement, ils sont ici au moins 2 jours. Et puis, le plan est s'ils ne sont pas ici pendant 2 jours de suite, ça va être assez difficile de faire les tests. Mais s'ils sont ici pour au moins 2 jours et ils sont testés quand ils arrivent, leurs résultats seront prêts le prochain jour. Alors, s'ils arrivent 10 heures le matin, le plan est que même le soir ou le matin après, ils seraient prêts. Alors, on va les appeler chacun pour dire qu'ils ont un test négatif.
OK. Et j'ai une question aussi sur les rassemblements extérieurs, les activités qui seront possibles à partir de demain. Est-ce que les équipes Search and Rescue seront toujours dans les parcs provinciaux pour vérifier la distance physique?
Je pense que oui. J'ai un rencontre ce soir pour confirmer, mais je pense que c'est le cas. Je pense que il fait beau aujourd'hui et j'imagine peut-être le week-end, je ne sais pas, mais je pense que leur présence serait une bonne chose.
Merci.
Okay. Just for English, I was asked if the ground search and rescue is planning to be at some of the parks as they have been the last couple of weekends, and I believe that's the case. That will be confirmed later on today, but I understand that is going to be the case, and if we're having some nicer weather, that just reinforcement of making sure that message is out there will be important. And the question prior was about the truck drivers, if they are getting tested, how do they get their results back and how quickly? And if they're getting tested, then they will get their results back. We will call them the next day if their results are, and be able to tell them their results are negative or positive, but it would be done. If they're turning around and just dropping off a load and not staying on Prince Edward Island, they would not be considered for testing.
François, Radio-Canada.
Bonjour, Dr. Morrison. Au cours des prochaines semaines, on va voir beaucoup de commerçants qui vont vouloir vous envoyer des plans pour réouvrir leurs portes à partir du 22 mai dans la deuxième phase de déconfinement. Je me demande quel genre d'informations, qu'est-ce que vous recherchez dans ces plans de la part des propriétaires de commerce pour que vous puissiez leur donner le OK pour ouvrir leurs portes et commencer à offrir des services à compter du 22 mai.
Bonjour, j'apprécie la question parce que on veut pas vraiment voir le plan de chaque organisation, mais on va avoir sur le website, j'imagine plus tard cet après-midi, demain, les choses qu'on veut voir si on fait une visite. Alors, vous avez les business ont besoin d'un plan, d'avoir un plan qui peut nous montrer, qui parle de comment ils essayent d'avoir la distance physique entre les personnes qui sont à l'intérieur. Il faut montrer qu'il y a un plan pour pour qu'ils lavent les mains assez souvent pour la public et pour les employés, qu'il y a plus de nettoyage à l'intérieur, qu'il avoir comment ils vont voir s'il y a quelqu'un qui ne sent pas bien, ils devraient pas être au travail. Alors, un processus d'être certain qu'il n'y en a pas des personnes qui sont malades au travail. Alors, ça va donner une liste des choses qu'on doit voir. Et puis, s'il y a un grand comme un type d'organisation comme les je ne sais pas, comme les terrains de golf, tout ensemble. On a travaillé avec eux pour avoir un plan pour tous les terrains de golf. Et puis, on travaille avec eux pour qu'ils distribuent cette information. Alors, ils savent quelle sorte de choses qu'on veut voir si on fait une visite ou si quelqu'un nous appelle pour dire il y a quelque chose qui ne va pas, un complaint, on va aller pour une visite et puis on va voir qu'il a un plan et le travail qu'ils ont fait.
Merci. Et vous avez mentionné aussi en anglais, juste m'assurer que j'ai bien compris, les rassemblements de masse, des rassemblements importants avec plusieurs dizaines de personnes d'ici la fin de l'été, ça semble être à oublier, ça. C'est bien ça?
Oui, je ne peux pas imaginer des grands rassemblements ici à l'île du Prince-Édouard. C'est difficile de prédire juste la date qu'on peut augmenter le nombre, mais je sais pour les quelques mois qui suivent, on peut peut-être changer le nombre de personnes, mais c'est pas un grand nombre avec un grand cancer, un grand mariage. Il y a trop de risques avec un grand nombre. Alors, ça va changer même dans les 2 mois qui suivent de 5 à 10 dehors jusqu'à 20 dehors. Mais j'imagine qu'on va pas voir les grands rassemblements pour un bout de temps.
Merci beaucoup.
OK, merci.
Stu Levy, The Guardian.
Hi, good afternoon. First question for Ms. Dowling. I think earlier this month, you mentioned that hospital capacity was down to as much as half at PCH and QEH. But I guess with the phase back and the reintroduction of medical services, I'm wondering in each of the phases what the capacity of those 2 hospitals will look like, from phase 1, 2, and 3.
Yeah. Hi. Yeah, we're looking at we have a plan together now which integrates our home-based care surge capacity and our hospital-based care surge capacity, and that's really what we're looking at with the reintroduction of services, how we balance that with what's going on with respect to COVID-19 on P.E.I. and the current numbers, if we have additional cases, how many symptoms or how ill those additional cases may be, if they're able to still continue to have mild symptoms and be at home, or if they're requiring additional care. We need to maintain a certain level of capacity as we move forward. And we've certainly been working with Dr. Morrison's team and the epidemiologists and our health information staff around trying to predict that when measures are released. And as we watch and wait, we have to keep some capacity. So I don't have the exact numbers for you, Stu, of what that would look like, but we won't be maintaining the same level of the 50% capacity to be available to respond to COVID patients as we move forward, because we're looking to release some of that back to services for islanders. But it will be a balanced approach to what we need to maintain, because our system is small, and I know I've said that here before, that it would not take a huge number of cases or community spread as we watch the measures being released for us to see that spike in cases and potentially have a need for our system. So we also, as we release the capacity to offering additional services like elective procedures and that type of thing, we would have to do those things with a plan to also regain that capacity should it be needed in a very short period of time.
Okay, thank you very much for that.
You're welcome.
Second question. Oh, sorry. Were you about to say something?
No, I just said you're welcome.
Okay. So second question, I suppose, for Dr. Morrison. forgive me if this has been talked about before, but I wondered what your thoughts were on serological testing. I guess the BC Centre for Disease Control says they're looking at as much as 17 of them. So wondering what the thoughts are here. Are we looking at a specific number of tests, or are we sort of just waiting for more direction from Public Health Agency of Canada at this point?
I think I did speak about this a couple of days ago, but the serological testing is something that certainly we've seen in some parts of the world and in the United States. And the serological testing, of course, is looking for immunity. And what they're not, they're still having to do some work on how good the tests are, because if it is showing that you have immunity, how is that actually does that translate into protection? So does a little bit of immunity protect you, and how well does that test measure that immunity? So it is absolutely something that country is continuing to look at. I know there are serological testing tests that are going through approval process in this country. We will continue to watch that, but it is not actively being done broadly in the country at this point in time, but everyone is paying attention to what that could look like and what it would mean, and but also even what the test results would mean if you get them, because we don't know how long immunity really lasts with COVID-19, and so there's a lot of research to be done in that area as we go forward as well.
Okay, thank you very much.
Thanks. Great, thank you very much.